The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here.
Hello, friends. Welcome back to our Building Your Registry episodes. Today, we're going to be talking about sleep aids. We're going to talk about sound machines and lovies and night lights and all of the different options that are out there and when those options might be helpful for you to have in your back pocket, if they're helpful to have in your back pocket. And Ciarra is going to be walking us through all of that today because she is a pediatric sleep consultant and she knows all the things that I don't know.
Yeah, and we're not talking about sleep aids like melatonin because don't even try it. No melatonin for your babies, please.
That's it. That's the whole episode.
And goodbye. We'll see you next week.
That's right. No. Okay. So to start us off, can you tell us what kind of things do you recommend to clients and when you're talking to them, with sleep consulting or with prenatally for sleep, what items do you recommend that they have?
Yeah. So the first one I'm going to mention is swaddles. And we've already done an episode about swaddles. Go back and listen to that one. We had Jess on for that. I think that swaddling is really helpful. And if you are not bed sharing, which AAP says not to, I'm not going into all of this, but you should at least be room sharing. It's not safe to have a swaddle on your baby if you are bed sharing. However, most people are room sharing or even maybe having their baby in their own room. And having a swaddle on helps prevent that Moro reflex from waking the baby up. So that Moro reflex is when they look like they're falling off of the side of a building and their little body goes their arms go out to the side and they flail. And that big movement wakes them up. So when you have your baby swaddled, it contains their arms and helps keep them tight. And then they aren't able to have their arms go out as far, and then it doesn't wake them up like that. But for them, it really does feel like they're falling off of the side of a building. I don't know if you've ever had a dream where you are falling in your dream and that sinking feeling in your stomach wakes you up. Similar concept for a baby. So big fan of swaddling, and a lot of people think, well, my baby doesn't like to be swaddled. If that's true, if you just feel like your baby is screaming out in pain when they're being swaddled, really seek out a chiropractor or craniosacral therapist, because a lot of times that indicates that there's some tension going on in their body. So outside of swaddling, I really love a sound machine. So there are positive sleep associations and negative sleep associations, or positive sleep crutches and negative sleep crutches. A positive sleep crutch is something that you can do and you can allow, give to your baby or have in your baby's environment, but it doesn't make you actively have to do something. And a negative sleep crutch is something where you're actively having to do it the whole time. Now, the word negative is a little harsh. I just mean for parents that don't want to be involved in their baby's sleep at that moment, it would be negative, right? So some people want to nurse their baby to sleep and be their baby's pacifier. I don't care. Do that. If that's working for you, awesome. But if it's not, then that would be a negative sleep association because you're going to be up all night with your baby nursing them. So a sound machine is one of them. A lot of parents do worry that this is going to cause hearing issues in their baby or whatever. You can go and look at what the recommended decibel height is or volume is for this. And there are even little apps you can download on your phone where you can monitor how many decibels are getting to where your baby's head rests in their crib and then where the sound machine is over there. And you can make sure that it's not too high. Now, for sound machines, I love a Dome, DOHM. It is the most simple. It's a fan, basically. It's a fan that makes noise. And there's a high and a low setting. It's so basic, and I really love it. There's also a Hatch sound machine. The Hatch is really cool because It also has features that are helpful later when your kiddo is getting older, like the okay to wake clock, where you can make it change colors. It's also a nightlight. You can set an alarm on it. But I really love that you can make it so that as your kiddo is getting older and you're helping them learn how to, like, when it's actually morning, and you can have the light turn green in the morning. You can also change it from your phone. You can change the, how loud or how quiet it is from your phone. So that's pretty cool. There's a lot of technology in there. So sound machine would be the first one. Any questions about sound machines, Sam? I get into this stuff and I'll just like keep rolling.
I don't think so. Both of my kids have used sound machines absolutely forever. They use just like one of the really basic ones you can get for $10, and we have it on the Ocean thing, and that's what they have had their entire lives, and it works really well. I think the other reason I really like sound machines is it is like portable. Like you can get the little travel sound machines and put them on your car seat for when you're out and about and baby needs to take a nap when you're out and about. Like, and it also kind of makes it so that especially when my kids were little, we would have to be sleeping in different places sometimes. Like if we had meetings at night, if I had like a church small group or something in the evening, I could put my kid down to sleep in somebody else's house in a different room, and it would still be familiar to them because they had their sound there. That was nice.
A lot of people are like, I do not want my kid to be reliant on a sound machine. Like there are really people that feel that way. It's not even about the like worrying about their hearing, which it's fine, guys, do the decibel trick thing. But it's a lot of times like, I don't want them to be reliant. And it's interesting because I find that dads are more this way. They like want their kid to be more resilient a lot of times. And hi, my name is Ciarra Morgan. I am 39 years old and I still sleep with a sound machine. Okay. Mine is actually double duty. It's something that you turn on and it's an air filter for the room, and it's really loud, and my husband hates it and he's learned to live with it. So I'm still 39 and I use a sound machine. When we go on vacation, I bring a sound machine with me, and it helps drown out all of the excess exterior noises. So that's really helpful. It also helps mimic that sound of the womb when they're just newly out. It was loud in the womb, you guys. So big fan of a sound machine. Night lights, I'm not pro or con nightlight. If you are feeding your baby in the middle of the night, you're probably going to need something that allows you to see a little bit. And we definitely don't want to be turning on a bright light overnight when we're feeding. So having some sort of small little light, even if it's one of those that plugs into the wall and can aim down at the floor and is only its motions or sensitive to how light it is in the room, and it only turns on at night. Those are kind of nice. Or sometimes, like, I even tell parents, if they don't have a nightlight, just turn on the flashlight on your phone to the most dim and have it pointed down at the floor so that it at least provides a little bit of ambient light, because you don't want to be turning on a bright light. Some kids want a nightlight, some don't. At newborn stage, that does not matter. It's been dark in the womb this entire time yet, you guys. So you'll even notice when a baby is born, they're pretty much trying to close their eyes, or they look quite offended by how bright it is. And the moment the lights are turned down in the room, it's like their eyes pop open. Like they feel much more comfortable now and they can look around. So I don't think a nightlight is a be all end all, but I think that it helps facilitate feeding in a way in the middle of the night that's not going to wake the baby up all the way.
Yeah. I have found I was super against night lights because I myself am super light sensitive when I'm sleeping. Like I can't have any, like I have to like put tape over any electronics in my room that have like a blue light. It drives me nuts.
Yes.
And then both of my kids, when they turned like 2 or 3, decided that they were scared of the dark or scared of something and they needed to have night lights. And so they both got like star things or galaxy things or some sort of something that shines on their ceiling, and they both still sleep with those. And now it's even gone a step further, and we have to have the hall light on so they can go to the bathroom. And that drives me crazy because I can see it under my door. And
this can be a power struggle. This can be a power struggle later on. So we'll talk. We're down to newborns, but for sure with that, they start to want more. Like you give them an inch and they want to take a mile, right?
Absolutely.
So, if you don't get them too used to a nightlight in the beginning, maybe it won't become an issue. But at a certain point, your kid's going to start, I need a drink of water. I need all of these things. I have something in my eye. I have to go potty. Like there's always going to be reasons for them to need to get out of bed and need more things. So, and then lovies are not really safe until at least after age 1. A lot of times they're saying age 2 to not put anything in the crib. So Lovies for awake time and just for cuddling is fine, but you're not supposed to put them in the bed with the baby when they're sleeping. So it can be for something cute, but not for longevity or keeping it so that they're actually reliant on it for sleep. And then another sleep aid is a pacifier, which we have an episode about a pacifier. I don't know if it'll come out before or after this, but passies can be really helpful. They do help reduce the risk of SIDS. Now, they can be helpful, but it also can be something that becomes a negative sleep crutch if your baby doesn't know how to get it in their mouth by themselves. So you're sitting there like replugging the baby's mouth with this passy every time they spit it out if they become reliant on it for sleep. This is something where with my daughter, I peppered the crib with like 10 passies, just praying that she would find one by herself. And just like with anything, our kiddos are going to learn skills at their own pace, or kind of when they find that they need to, like, the necessity is the invention of figuring that out. So you could practice like at tummy time. As your baby's getting a little bit bigger, you could put a few passies within their reach, and you can kind of model for them how to put that in their mouth, and then showing them how to do that and helping them grab it with their hand and put it in their mouth, and then seeing what they do and just trying to encourage them being able to do that, because the sooner they can put it in their mouth by themselves, the sooner you're not the one who has to replace it when they're falling asleep. So it can be a positive and a negative sleep crutch, and it's obviously something that you're going to want to take away eventually, because we don't want our kiddos having pacifiers at 5. Yes, my daughter did have one at 5, and I don't care if you judge me. Everyone else really was upset about it.
Pacifiers are so much easier to get rid of than the thumb, you guys.
We both speak from experience.
Yes, we're speaking from experience here. You can send the passies to the passy fairy or cut holes in them or do whatever. What are you going to do with the thumb? Like, I can put the nail polish on it.
Your daughter does not care. No.
And we finally just broke the thumb sucking thing because her dentist.
Her thumb? No, I'm kidding.
I felt like I might have to if we kept going. Her dentist was literally like, "Hey, if you can come to your next appointment and not have sucked your thumb, then you can get an extra treat." And she was like, "Okay." Never sucked her thumb again. I swear to God, you guys.
This is not applicable, but I'm telling you guys a funny story, because one day I had braces not very long ago, and one day Sam left the dentist with her daughter, and she goes, "Ciarra, if my daughter ever asks you about your braces or next time she sees you." Did you? Oh,
we called you.
Yeah, you prepped me for a phone call. You were like, "You need to tell her that you hate your braces and that they're the worst thing you ever had," because she was just at the dentist, and the dentist told her if she keeps sucking her thumb, she's going to have braces one day. And on the drive home, she started talking about what color bands she's going to put on her braces.
Yep. That's my daughter. It's not applicable.
God, so
pacifiers are better than thumbs, but I tried to give her a pacifier and she didn't want a pacifier either. So
that was my favorite. My son wouldn't take anything. He wouldn't do a passy. He wouldn't do a thumb. It was nurse or bust. And, we did the sound machine. Also, and this is another sleep aid, is blackout curtains, especially because of during the day. It is not going to be very dark in their room, and we want to try to have the same sleep space overnight as we're doing during the day, because if we have them in super comfy during the day, they're not going to want to sleep on the harder mattress at night. So having that, and then also when you're traveling, you can recreate these things. You can bring, they make all sorts of really cool things on Amazon where you can do blackout curtains in the room that you're in a hotel room or an Airbnb or something.
I would carry black trash bags and tape, and I would just tape black trash bags over the windows everywhere we went.
You guys, you think before you have kids, you're like, I would never. This is ridiculous. And then you have kids, you're like, what can we do to help their sleep?
I do want to go back to lovies for a minute, because I have, I guess, a thought and a question. Okay. So my question is, one, did this change for the recommendation for when they can have things in their bed? Because I feel like when my kids were little, it was like once they were rolling by themselves, they could have like one small something in the bed, or like, I don't remember what it was exactly.
I don't know what year it was that it was recommended, but they are not supposed to have anything in their bed, especially because a lot of them are little heads with a tiny little blanket attached to them.
Yeah.
So that can still be a suffocation risk. Even a stuffed animal can, because even if they can roll, they could roll toward it and be rebreathing their own
True.
air.
Yeah.
And so they're not getting as much oxygen. It's a barrier, kind of like there would be a barrier of like, you're not supposed to have a bumper in the bed, that sort of thing. So no lovies in the bed. I don't know what year that was decided, but it's not safe, even if they are rolling over before age 1.
It makes a lot of sense. I can definitely see it. My kids were lunatics.
I mean, my 15-year-old would literally put her lovies on her face under age 1, and she wouldn't sleep unless they were on her face. And you know better, you do better. Okay. Well, we didn't know better then.
Yeah, that's exactly right. Yeah. I'll say for my one comment on lovies is I think this is another really great travel option once they get a little bit older, especially if you're starting to look at like Mother's Day out or daycares or things like that, having something that they sleep with at home that they can take with them, where they go. For us, we got lovies when they were newborns, and I would hold it when I was nursing them. And then I could put it, with them for their tummy time on the floor or, in the bouncer or whatever. And that was their like comfort item. That was really nice. And then as they got older, they were able to start sleeping with it. And then they would take it to Mother's Day out with them and they could sleep there or anywhere. And that was really nice. I'll say with that, my pro tip though, is if you're going to introduce a lovey, get at least multiple 2 that are identical. You have to hide one because it's so bad to lose.
But exchange them. Because here, I did that with my daughter. She had her bunny and I had an extra bunny up in the cabinet and I would wash that bunny all the time and it started to get ripped. So I brought out a new bunny and I traded it out. And she goes, I don't like this bunny. And I said, why? And she said, because it's not stinky and it doesn't feel right. Like, they get their smell to them even when you wash them. And it was plush and bright. And she's like, it's not even the right color. I'm like, well, that's what color yours used to be. So you got to wash them at the same pace and rotate them out.
You guys, my daughter, because she is the chaos goblin in my house, she has a lovey that she's had since she was a newborn. Her big brother bought it for her. And that was his welcome to the family present. So she's had this lovey since she was a baby. We went on a weekend trip and it got left at the hotel. And I realized it before we were even halfway home, called them. They were like, nope, room's already been cleaned. It's gone. Heartbreak. She cried for weeks. This was beginning of December when she was probably 3. It was horrible. And I was heartbroken because I felt like it was just this piece of her babyhood that was gone. I went everywhere trying to find this lovey. I ended up going and posting on a mom group and was like, total long shot. Does anybody have this lovey? There was someone who had it 45 minutes from me. And I went and picked up that lovey. I'm sorry.
That's amazing.
Let me rephrase this. Santa went and picked up this lovey and it was in her stocking on Christmas morning. And she was just the happiest she's ever been in her life. So now we have that lovey. And now we also have a rule in our house that we have travel loveys that are the only loveys that are allowed to leave her room. They are different, but that's the pro tip.
It's always the risk you take leaving the house with a lovey. So really, I don't think that there are, the wrong sound machine you can get, the wrong nightlight you can get, just making sure that it's not something that's too loud, that's going to be dangerous, having an ability to change the volume, or at least you can push it further away from the bed if it's too loud, making sure that it's something that you can travel with, or you can at least have something that's kind of recreating that noise that you can travel with if it's, the hatch is a little bit big sometimes to be bringing everywhere. And then also some sort of nightlight that's easily transportable between places. And then as far as, mistakes that we make or being not helpful, really, it's not a mistake. It's just there are some things that will cause you to have to put more effort in. And if independent sleep outside of needing to feed, because we shouldn't be trying to make our babies sleep through the night at a young age. They still biologically need to eat. But when we're not feeding them, how they're falling asleep, if we don't want to have such a big role in being the one that's always necessary to get them to sleep, we got to be careful about the things that we're putting in, or the things that we're doing. So if we're sitting there shushing and patting our baby and that gets them to sleep, and they need us to do that every time, they're going to want us to do that at 3 a.m. when they wake up too after they've had a feed.
I think it's about finding sustainable practices. So whatever it is that you're setting up, is this something that you're going to be able to sustain, that grandma is going to be able to sustain when you want a night out? like thinking through, I mean, I think when we're talking about anything, is nursing to sleep sustainable by grandma?
Mm-hmm.
Probably not, which means you have to do that and
you're stuck there.
You don't get to go anywhere else. And, so make those decisions that are best for your family. Think about the nightlights that are best for your family, but maybe think about things that are going to be transferable as they get older. Don't pick a sound for the sound machine that only this specific sound machine has. It plays a song in this tone at this whatever decibel that you cannot
I'm actually not even
Spotify.
a fan. I'm actually not even a fan of the ocean noises. I know that's what y'all use, but it's
so
not
specific. Yeah.
And it's not even. So it can be distracting to their sleep cycle at some point, or like some of them have birds in the background or something like that. And so it just really depends on the kid, right? But exactly, it's not, you can't replicate it with just any old machine. We were just traveling last weekend and I didn't bring a sound machine for myself. And I brought it for our son and I was like, crap, I forgot mine. Like I realized it that night that we get there. And my sweet husband, he tried to turn on, we were in an RV and he turned on the fan for the whole RV and it was so loud. He was like, we're not doing that. Like that's too much. And he just got a white noise app on his phone and turned it on and I slept like a baby.
Yep, exactly. Finding, I think I really truly think it's like, that's my pro mom tip is find things that are going to be sustainable and replicable in other settings.
Agreed. All right, y'all. I hope that this was helpful and we will talk to y'all soon. Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.